We find that we residents, staff and faculty are really passionate about medicine and mental health and serving the underserved of Boston. I'm very, very grateful to be training as a psychiatry resident at BMC.
BMC and BU will lead the way in understanding and developing effective treatments for our patient population. And so I feel that we are responsible for doing that.
What I love most about the psychiatry program here at Boston Medical Center is that I not only get to serve a diverse patient population, but I'm also surrounded by passion and innovation from my faculty and colleagues that ensures we're doing this in a fair and equitable way. I'm Natasha Nazari, and I'm a psychiatry resident here at Boston Medical Center. If you want to follow me, I'll show you around. What's the experience been like coming from Puerto Rico and adjusting to a new city and a new program?
So I think that the experience of coming from Puerto Rico and, adjusting to this program in Boston has been actually better than I expected. The population that we treat here has made it a little bit of a little bit from home being here in Boston. A lot of my patients are Spanish-speaking patients, so that has been something that has been really nice to be able to train in a program in the United States, but still have that population. I think that one of the things that has been really good is that they've been mentors in the clinical experience, but also in the academia and writing and just being there for you and guiding in terms of writing papers, posters have been also something that I've gotten. So that has been something amazing.
That's amazing. Thank you so much. Hey, Dr. Tam.
Hi.
Can I come in and speak with you?
Yeah, come on in.
Thanks.
I did my residency training here at BMC as well as my fellowship training, and during those years I found that I really enjoyed working with the patient population that we serve here at the hospital. And not only that, but I thought that everyone who works here were also very passionate about the work that they're doing, and it was just a very positive environment to work in. So we have a lot of research opportunities for residents to get involved in, both clinical research as well as quality improvement, which is more of an institutional-based process improvement research. And for the clinical research, we often refer our residents to Dr. Christina Borba, who is the research director here at the residency program, and she's really great. She's very enthusiastic about research, and the residents have always had very positive experiences working with her and her team.
Have a good rest of your day.
Thanks, you too.
I just want to continue to see our program flourish. My hope over time is that we'll grow leaders within psychiatry who can go on to essentially replicate the BMC model in other places. So whether that's in other academic centers or they're starting community clinics, the goal is to just expand exceptional psychiatric care for every patient throughout the country and throughout the world. I have a personal interest in cultural psychiatry, so I really think in that lens, and my hope is that all the residents who come through this program will also start to think in that lens, that every interaction between a patient and a provider is, in some level, a clash of cultures. Even if you speak the same language or happen to have the same gender identity or happen to have the same color of skin, there's still some level of difference. And for us to be able to help our patients acknowledge that and explore it and explore the meaning of mental health to them and how to help them live the best life that they can live is the way I would like for residents who leave this program to think about psychiatry.
As a CL attending here, in addition to my multiple other jobs, and I love being a part of that team. And so that's been a real defining part of my experience at BMC, is just the camaraderie as part of our team. And I think that really comes true in the residency as well. I get a sense that all of the residents really like being a part of the same team together, and I'm really happy to be a part of the residency team now too. One of the biggest reasons that I was interested in becoming part of the residency administration is because I wanted to think about how we're training residents to do psychotherapy here. And I think that we have a real opportunity, because of the type of patients that we work with at BMC, to train folks how to think about development and developmental trauma, in addition to the very obvious traumatic events that many of our patients experience during their lives. And I'm very interested in psychodynamics and psychoanalytic psychotherapy, and I think that those two things marry together really nicely. So I'm very interested in sort of revamping the psychotherapy training that residents receive here.
Hey, Manasa.
Hey, Natasha.
This is my co-resident, Manasa. She'll be taking over the tour from here.
Hi, my name's Manas Bamza. One of my favorite things about BMC is definitely the people. I did an away rotation here when I was a fourth-year medical student, and I just remember how warm and supportive all of the attendings and residents were. They really made me feel like a valuable part of the team. Let's go see if we can find some people to talk to. Hey, Tam. Is it okay if we come and talk?
I feel very confident and grateful to be training at an institution that cares not only deeply about the biology, the research, and latest clinical trials in academic medicine, but concurrently cares very deeply about the structural and socioeconomic factors that have very defining roles in determining the outcomes of the research and latest clinical advancements in academic medicine. I feel confident and grateful to be training at an institution where I found those individuals that are also very passionate about treating the individual through collaborative means, and also advocating for the most vulnerable and often neglected communities of Boston.
Well, thank you so much for taking the time to talk to us, Tam.
Of course. Anytime.
How was it moving here from Columbia?
Supervision in our program actually takes a couple different forms. So the residents here have individual psychopharmacology supervision, they have individual psychotherapy supervision, and then as the site supervisor, I'm also accessible to the residents whenever they want to discuss a case or just run some ideas by me. We definitely encourage the residents to formulate their cases in a culturally competent and in a systems-based approach. We actually have something quite unique and interesting here known as MDT, or Multidisciplinary Team Meeting. And this is something that happens once a week for an hour, where the residents attend a meeting that has social workers, therapists, and various other clinicians from other specialties, where they can learn to discuss cases and formulate cases through the lens of other specialties. So it's definitely something that is very interesting and useful for the residents to participate in.
So what's it like being a guest on the other services, like neurology and IM?
I was on geriatric medicine, and that was really nice to see, actually working with geriatric psychiatrists. The consult service was very active with our patients, so that was nice to see.
I was on neurology last, and I think I just got lucky and had an amazing team, which was great. My attending loved to teach, so we talked a lot about various concepts, and I got to see a lot of various different neuropathology on the rotation too, which was a great learning experience, and seeing the overlap between neurology and psychiatry is really important for us all to understand going forward.
Yeah, and also just coming from a more demanding off service rotation, having these social events with our psychiatry group has really been awesome.
Well, I came to BMC and BU about 5 years ago from Mass General. And when I got here, I realized that this is an awesome place, but it had yet to reach its potential. And so one of the visions that I have for the program really is to develop physicians who are not only excellent clinicians, but also excellent teachers and researchers. One of the things that we've done is to really expand our capacity, particularly to better understand and how to care for our patient population. And so we've taken individuals who, whether they were experienced with research or scared to death of research, we have the infrastructure in order to help them conduct research projects. There are so many questions yet to be answered about our patients and how to best understand our patients and best care for our patients. And so I feel that we are responsible for doing that. So we wanted to develop a program and department to address those issues for our patients. And I see that over the next 5 to 10 years, BMC and BU will lead the way in understanding and developing effective treatments for our patient population.
So if you had to choose one word to describe your experience at BMC, what would you choose?
Memorable.
Collaborative.
Belonging.
Vibrant.
Innovative.
Diverse.
Commitment.
Awesome.
Family.
Camaraderie.
Genuine. Ahead of its time.
Passion and compassion.